Hi, everyone. My name's Karen Gerner, and I'm a Medicare specialist. I've been licensed in the insurance industry, health insurance, since 2008, July 1st. So I just had my 11th year anniversary. I've helped a lot of people in 11 years. I'll tell you what, I've given this presentation probably thousands of times. So, anyway, this is going to be a Medicare 101. This is for all of you new people, new to Medicare that just don't understand or don't know where to start. So I'm going to give you the basics, and I'm going to basically, what I do is I use this book. It's the Medicare and You book. I call it the Medicare Bible. It's issued by the government. There's their logos on the bottom there. Medicare has two logos. They have the eagle with the circle around it, and then CMS stands for Center for Medicare and Medicaid Services. So anything you get in the mail that has either of those two logos, you will know is official government business. So when you're turning 65, you're inundated with phone calls and mail and so forth. Excuse me. And so it's hard to know what's real and what's not. And that's half the confusion. So a lot of companies try to disguise their marketing material to look like official government business so that you'll open it and read it and hopefully give them a phone call. So anyway, Medicare basically has two ways to go, two options. There they are, your Medicare options. So I'm going to talk about both of them and a little bit about supplemental and drug plans, and then we're going to call it a day for now. But anyway, the first way to do Medicare is what's called original Medicare. That's parts A and B. When you enroll in Medicare, you're going to automatically be enrolled in A and B as, if you want to. If you're still working and you're going to work till 66, for example, because full retirement age isn't until 66, you'll probably apply for just Part A and hold off on your Part B until you retire. And you will not be penalized for that. As long as you have credible coverage, you're fine. So Part A has no monthly premium, as long as you've either put in 40 quarters or your spouse has. So even if you've been a housewife and you haven't worked, you'll still be eligible for Medicare. No problem there. And if you decide to keep working until 66, 67, whenever, you can pick up Medicare at any point at that time, and you won't be penalized for not having coverage as long as you've had insurance through your employer. All right, so when you apply for Medicare, you can start doing that 3 months ahead of time. That's the magic number. You can't do it 4 months or 5 months. They make you wait till it's 3 months on the dot. And then you'll enroll in Part A's and Part B. That's going to run you, A, like I said, is no charge. B has a premium of $135.50. It starts at that. If you earn over $85,000 as an individual or $170,000 as a married couple, you'll pay a little more for your Medicare based on your income. That's called your IRMA, not to be confused with the hurricane. It's your income-related amount that'll be added on. And that can fluctuate. If your income goes up and down over the next few years, so is your IRMA. It's going to be affected. So you're going to pay IRMA on your Part B premium and also on your Part D premium. So that is, there's a chart for that. I can share that with you at some other point, or you can call me and I'm happy to give you the numbers. But if you stay with Part A and Part B, that's the official government insurance program, and it's national. So it's good at any hospital, any doctor in the United States that accepts Medicare patients. So there's no networks to deal with. If you want to, hop in your car from Florida and drive to Texas to see a doctor, you can do so, as long as you're in traditional Medicare. With traditional Medicare, of course, there's gaps, and I'm going to go through, what it covers and what it doesn't cover. Most people pick up a supplement to pick up the holes in Medicare, and then also a Part D to cover drug coverage. So first of all, I'm going to talk about what Part A covers. I don't know if you can see my chart back here, but Part A is your hospital insurance. So if you're admitted into the hospital, not as an observation, but actually admitted, then it goes by what's called a benefit period of 60 days. So your deductible for Part A is $1,364. Then whether you're in the hospital 1 day, 10 days, or 60 days, That's what it's going to cost. That's just for room and board. If you're in the hospital for what's considered a catastrophic hospitalization, days 61 through 90, your copay goes to $341 per day. And days 91 through 150, it jumps up to $682 per day. So for a total maximum exposure of almost $41,000, that's a big number that you don't want to have to deal with. And that doesn't include doctors or anything else. That's just the hospital room and board. The other thing that falls under Part A is any kind of skilled nursing confinement following a hospitalization. And the rule is you have to be in the hospital for at least 3 nights. Then if you're moved into like a skilled nursing facility for some additional rehab, Medicare is going to cover the first 20 days of that at 100%, which is awesome. It's only a couple things they cover at 100%, and that's one of them. But the average length of stay that somebody is in rehab is 30 to 45 days. So your copayment after day 20, so 21 through 100, is $170.50. And then after day 100, you're on your own. That's where like a long-term care policy would kick in and take over, hopefully, if you've done that. So that's the hospital, room and board, and skilled nursing. So everything else falls under Part B. And doctors, your preventative care, any kind of diagnostic, x-rays, CAT scans, C scans, anything like that is falling under B. And first thing that happens under Part B, if you had just straight Medicare, is you have an annual deductible of $185. These numbers do tend to go up every year, but for 2019, these are the magic numbers. If you went to the doctor, the first time you're on Medicare, you'd pay the full bill. Once you met your deductible, then Medicare goes to 80-20. So Medicare pays 80%, and you're responsible for 20%, but of the approved amount. So Medicare doesn't pay 80% of the total bill. They have negotiated rates, just like every other insurance company, and that's called the DRG, Diagnostic Related Groups. So for every medical code, there's a set number that they're going to pay. Depending on where you live, they might vary from state to state or county to county, but it's a set amount. So let's say, for example, you had a hip replacement. And I'm just guessing at these numbers. I didn't check the DRG, but and the hip replacement was $100,000. They would submit the bill to Medicare. Medicare would come back and say, "Oh no, we're only going to approve 50,000 of that hip replacement," and then they would pay 80% of the 50, and you'd be responsible for 20% of the 50 or $10,000. So instead of a $100,000 bill, it's down to 10,000, which is still a big number. That's why people get supplements to cover the gaps. The other thing that's under B is, your blood work. Most of the time, Medicare covers all of that at 100%. There is a chance you could run into some excess charges, which happens when you go to see a provider that does not have a contract with Medicare. I don't see that happen very often, but maybe a chiropractor or something of that nature that is a small practice that doesn't want to deal with insurance. So then they can bill you in up and above what Medicare approved rates would be, and you'd be responsible for that. Home health care, if it's approved, so say you need somebody to come in and change some dressings or, I don't manage your medications, for example. That's covered at 100% as long as it's pre-approved. And then durable medical equipment is covered at 80%. So if you needed a wheelchair or oxygen or a hospital bed or something like that, you'd have a 20% copay on things like that. Outpatient hospital treatments, there's co-insurance. It just completely depends on what it is. I know somebody that had a hip replacement done outpatient, and their portion of that without any insurance was pretty high. So it just depends again on what it is. And then blood work. Medicare does not, if you needed a blood transfusion, Medicare does not cover the first 3 pints of blood. And then after that, you have a 20% co-insurance on any kind of blood. So that's basically Medicare, what it covers, what it doesn't cover. So again, that's why people get supplemental insurance to cover the gaps in Medicare. And supplements can range anywhere from $49 a month up to a couple $100 a month, depending on how much coverage you want. And those are rates at age 65. The older you get, when you sign up for a supplement, that's the rate you're going to pay. So as you age, the rates go up. But you do get kind of locked in. They call it Forever 65, because they're not going to raise your rates because you're getting older or because you're getting sick. It's all regulated by the government. So that's why most people don't ever change their supplement. They can never find anything less expensive because they've been locked in at that rate they were when they were 65. So the other thing you need if you decide to stay with Part A and Part B of traditional Medicare is a drug plan. And in Sarasota County in 2019, there are 27 different prescription plans available for purchase. How do you pick one? That's the key. And that's another confusing issue. I work very diligently to make sure that people are in the right plan every single year. I do a review for all of my clients every year, and it's daunting. But, I would just feel terrible if somebody got into a plan and their medication wasn't covered for the next year, because they change things every year. So I get a list of your meds, the dosage, the quantity. I run it through the system, and then I make a recommendation based on your personal situation. So that's Medicare, traditional Medicare A, B, and D, and then a supplement. So the other way to do Medicare is what's called Medicare Advantage. It's actually Part C. And these are what the doctors, hospitals call Medicare replacement plans. So instead of using your Medicare card, you're going to take that and lock it up in the safe because you're not going to use it. Your Medicare Advantage plan could be with Blue Cross or United Healthcare or Cigna or Aetna or Humana, whoever it's with. That's the card you're going to use when you go to the doctor. So most of those type of plans don't have a monthly premium. Some do, depending on, the bells and whistles that they offer. But most of them don't. But you're going to pay as you go along. So you might have a copay when you go to your doctor. You'd have a copay when you see a specialist. If you're admitted into the hospital, you have a copay per day for the hospital up to so many days and so forth. So it's either going to be an HMO or a PPO. An HMO has 0 out-of-network benefits. So if you need to go see a provider for whatever reason that's out of the network, then you're going to pay for them 100%. So a PPO has out-of-network benefits, but the rates are going to be lower if you stay in network versus going out of network. Also, a PPO a lot of times can be good in other states. So if you're a snowbird and you travel back and forth from Florida to wherever up north, PPO is probably going to work better for you in that situation. So, and there's a lot of different options when it comes to Medicare Advantage. It's mind-boggling, how many different options there are. There's also special plans for people that are what's called dual eligible, which is Medicaid and Medicare. There's chronic plans for people that have maybe COPD or a heart condition or diabetes that are specialized to help them manage with their health care. And so that's how Medicare Advantage works. And again, my name's Karen Gerner. I don't know how many people I've talked to over the years. I haven't kept track, but what I do know is that I sit down, I come to your home, and I find out what your personal situation is. Everybody has a different health, has different budgets, and so forth. And I try to guide you or educate you so that you know what is going to be best for you and your family. So I would love to come meet with you face to face. Go over this, sitting across the table is a lot easier, and, figure out what's going to work best for you. So the way to reach me is through my office number is 941-716-0962. That's 941-716-0962. Or you can email me at Karen, CG, that's Karen, C as in cat, G as in girl, .insurance@gmail.com. And I would love to get together and meet you and, and help you figure out how to work the crazy world of Medicare. So I hope to hear from you soon. If you please would like me, the button right below this video, so I can get some exposure. This is actually my first time doing this, and I look forward to connecting with a bunch of you out there. All right, bye for now.